Hi health advocates, welcome back to my channel. In this video, I'm going to share with you how to create and record a chief complaint and why it is important for you to have your chief complaints ready prior to the medical appointment. By the end of this video, you should have a full understanding of how a chief complaint is to be properly presented to the healthcare professional to get the most accurate diagnosis and the best possible treatment in the least amount of time. And if you haven't done so already, please go to the Comprehensive Guide to Self-Health Management and turn to section 4.1. And if you don't have the book, just go to the description box below. I have included all the tools and information you will need to follow along. And if we haven't met before, hi, my name is Jennifer. I'm the creator of the Patient Better program. Welcome to my channel. This channel was created for everyday people, such as patients, families, and caregivers just like yourself, to learn how to manage care more easily and independently. And if you haven't done so already, please share this video with someone that could benefit from watching, as well as click the subscribe button and ring the bell to be the first to get notified for the best tips and tools to become the most amazing health advocate on your care team. Now let's dive in the medical encounter by creating a chief complaint. The first thing that we will need is to define what is a chief complaint. The definition of a chief complaint is a concise statement describing the symptom, problem, or condition, or any other reason that you may want to see a physician. For coverage purposes, the nature of your chief complaint may determine if the services are accepted by your health insurance. The chief complaint often guides the diagnostic decision-making and care. It also supplies vital data, which is the element that is collected by regional and state public health systems to monitor for disease outbreaks. I will show you how that works in another video titled The Small Big Small Picture. Now, in a routine medical visit, chief complaints are the second step of the medical history taken. Clinicians may refer to chief complaints as to the reason for the encounter, the presenting problem, or problems on admission. In the treatment room, clinicians will ask open-ended questions when obtaining the chief complaints. This takes up a significant amount of time in the treatment room because you are doing it primarily on recollection. So in the Patient Better Academy video coming up next, we will go through the routine questions that healthcare professionals often ask and how to create chief complaints prior to the appointment. Afterward, I will come back to show you how to record your chief complaints on your Patient Better soap note. In every encounter, your physician will want to know, how is my patient doing today? Are there any changes to my patient's health? And if my patient is taking any new medication. Here is the anatomy of a chief complaint and how it should be documented. First is the primary mention, which should be the title of the health issue, the location, where is the health issue located, the duration, for how long has the health issue lasted, the severity, how bad does the health issue hurt or irritate. Lastly is a secondary mention, which is the reporting of occurrence that may have provoked the health issue itself. And just like Janie, you're able to document each chief complaint and have an activity-driven appointment every time. When you first enter the treatment room, your vitals are documented as they act like the what in your treatment. Then, the chief complaints are examined and assessed, so it is important to have them ready prior to the visit as it greatly reduces the chance of you and your clinician falling behind schedule. Furthermore, it helps the clinician create the best possible treatment for all that ails you in between appointments. But first, before we dive into the soap note, let's get a little history. The SOAP note originated from the Problem-Oriented Medical Record, or POMR, developed by Dr. Lawrence Weed. It was initially developed for physicians, who at the time were the only healthcare providers allowed to write in a medical record. Today, it is widely adopted as a communication tool between interdisciplinary healthcare providers as a way to document a patient's progress. Now let's document our own chief complaints. All right, welcome back everybody. So now we're going to go to the Patient Better SOAP note. This SOAP note is specifically created for everyday people to communicate with health professionals. You will see that this SOAP note likens itself to the healthcare professional SOAP note for easy understanding and communicating for both parties. All you do, key in the Patient Better website, hover over Resources, click Tools. Find the SOAP note and click on that. All right, so let's go through a demonstration of how you would use the SOAP note chief complaints. There are 4 issues for chief complaints here on your SOAP note. We will go in to the SOAP note and how to create a full SOAP note in another video. For today, we're going to focus on the issues or the chief complaints. One of the things that we have to focus on is the specialist that we're going to see. Primary overseeing physician. It's okay to put all of everything that you have in here, just so that they're on the same page. So for issue number 1, either you can write this or you can type it in. Let's say you have recurring headaches. Okay, put the start date. About 3 months ago, you've realized that it's been happening consistently. The location, the duration. That's about 1 or 2 days. Severity. You notice that you had to take a couple of aspirin, although it did not put you down. And then if there was any other comments that you would have. All right. Issue number 2. You stubbed your toe. And when did this happen? Last week. The location. The duration. Severity. So even though these issues here are pretty basic and nothing to really get concerned about, it's always good to have something like this so that way you don't feel that you're moving on recollection, that you're participating in the office visit alone. However, a couple of months ago, you got a stomach bug while you were on vacation, and there, the doctor gave you some antibiotics that just needed a little bit of rest. And that is how you prepare for the doctor's appointments, by filling out your chief complaints prior to the medical appointment. And that wraps up our tutorial for today. You know, I would love to hear about your experiences with your chief complaints. Of course, omit anything that has to do with any specific diagnosis, as we don't want to solicit, as we don't want to attract any solicitors, and we don't provide any medical advice. This forum is created for and by everyday people. And thank you once again for being the best part of Patient Better. Till next time.